Alrighty, we might get started. Thank you all so much for joining us this evening. For those of you who don't know, my name is Samantha Hill. I'm the Rural Health Careers Coordinator for Hauora Taiwhenua, which is the Rural Health Network. And tonight we have Asia with us, who is a third-year pharmacy student at Auckland University. So they're kindly presenting to us a little bit what it's like studying pharmacy and answering some of the questions that have been submitted through our form, as well as any live questions that you may have. Um, we have had quite a few webinars this past week, and we've got one more day to go after this. So please, thank you so much for joining us. And if you do have any further questions as well, please feel free to contact us and we'd love to answer them for you. So firstly, a little bit how the session will run. So Asia will present some information about what it's like in their degree, which will take about 10 to 15 minutes. We'll then open for a Q&A. As I mentioned, we do have some questions submitted through our registration form, but if you do have any questions yourselves, please feel free to pop them down in the chat. I'll keep an eye on them and then read them out on your behalf. And then Asia will try to answer them to the best of her ability. If you can stay muted throughout the presentation as well, just to ensure we reduce any background noise, that would be much appreciated. Otherwise, we will get started. Asia, can you take it away?
Yep, can do. Thank you, Sam. Hi everyone. I'm Asia. So I'm a third year pharmacy student at the University of Auckland. I came into this program as a postgraduate student, but for pharmacy in New Zealand, you don't have to. So I'm third year, and basically the way pharmacy works, it's done in two universities, so Otago and Auckland, and it's in both universities. If you do the full program, it's 4 years. So if you're doing it at Auckland, you would start with either first year biomedical science or first year health science, and you can apply in that first year and move into it as an undergraduate and do that as your undergraduate degree. And if you are going to Otago, if that's where you want to do uni, then you would do it through the first year health sciences pathway. And through both unis, you use those pathways to get into all of the different clinical programs. So for pharmacy, you can do it through, if you're doing it at Auckland, you can do it through health science or through biomed, which basically best to just cater it towards which subjects you're better at. If you're going to Auckland and you want to go into pharmacy, you can go health science or biomed. If you go the health science route, you're going to be doing more population health-based subjects, so more English-based, statistics, writing. So you're looking at like bigger picture health. So basically a wider range of people, large groups. And if you go the biomed route, it is definitely more sciencey, so more of your more intense in terms of like your biology. And through both of those programs, you do 4 core papers, and that's the same depending on which pathway, specifically if you're wanting to go into any of the clinical programs. If you wanted to do any of there's a couple of clinical programs that you can't go through in Auckland using first year health science. So if you wanted to do optometry or medical imaging at Auckland, you have to do biomed because you have to take physics. But for pharmacy, you don't have to take physics, which is quite helpful. So there, you're basically your 2 entry pathways. Alternatively, there will also be the University of Waikato are going to be doing a Masters of Pharmacy Practice program, which should be, I think they're taking enrollments. So that's obviously for people who have already done a degree. You would do it as a master's and basically shorten the time. So when you do first year, that is basically you're in a big group of people. People might not be wanting to go into clinical programs. They might just be wanting to keep it general and do like just biomed or health sci. Other people will be trying to apply into the clinicals. And when you're in that first year, you're in big classes like 500 to 1,000 people some of the time if you're in those core papers. The 4 cores that you do at Auckland is you do a chemistry paper, which is Chem 110. You do Biosci 107, so basically a cell, like a human cell biology paper. You do Population Health 111, And then, so that's your semester 1, your 3 cores. And then in semester 2, you do MedSci 142, which is anatomy and physiology. So they're the ones that you really want to focus on if your goal is getting into clinical programs. And for pharmacy in particular, obviously it's pharmacy. We're looking at like molecular structures. We're thinking about medicines, how they work in the body, what our body does to the medicines. So it's probably more of a focus on like the chemistry side. But we do, like, I think a lot of people think that for pharmacy, you're only thinking about medicines themselves, but actually about what a lot of what we learn in pharmacy is the whole body and like the whole body's health. So say at the moment I'm doing my like ophthalmology module, so the eyes. So that's like 2 weeks that we've done that. And we do learn about all of the medicines that we use to treat the eyes, but you also have to know a lot about how the eyes themselves work, because if you don't know how that organ works, how are you going to be able to understand how the drug itself works in the body? So there's more to pharmacy than just chemistry. And the nice thing about pharmacy is it's not the kind of career where you're stuck in a lab all day. So sometimes people think that pharmacy has a lot to do with drug development and creating new medicines, and you can do that in pharmacy, but more of that is done these days by medicinal chemists. So pharmacy itself is more of a patient-centered career. You're the one who's ensuring medicines are safe when you're giving them to people. So you're less involved in the bringing them to market, although you can do that if you want to, and you're more in that role of kind of bridging the gap between prescribers, so like doctors, nurse practitioners, dentists. You're bridging the gap between them and a patient, and basically trying to educate the patient on how to take their medicines, what's teaching them about like why they're safe, and trying to help them with any like questions and concerns they might have about their medicines. So pharmacy is less lab based than what people think a lot of the time. And yeah, you're more in that patient-centered role, which if that's what you like, definitely pharmacy is a good degree to do. So once you've moved past that first year and you get into pharmacy, you do 3 more years. And in those 3 years, you basically do blocks. So it's pretty similar between Otago and Auckland. You work through organ systems and you learn the diseases that would be treated and what medicines we use to treat them, and basically how to educate patients and speak to doctors and nurses about the medicines. And then you have tests throughout that period. So in Auckland, once you move into that second year, you work in modules. So you would do infectious disease for 4 weeks, and then you sit a test at the end of that infectious disease module. And then the next week, you'll move on to a different module. So it's definitely, I don't know, a lot more focused. So if you find that you struggle to learn multiple subjects at the same time, like when you're in high school and it's like you're going to school and you're doing an English paper and you've got chemistry and biology and statistics, you're having to learn different papers all in one go, and you're going to be sitting exams for them all around the same time. What's nice about pharmacy is you're focusing on one particular topic in one go. So like I say, you're going to be doing like infectious disease, you do it for 4 weeks, you sit the test, that's it. Like your main focus on that has moved out of the way. It doesn't mean you don't use it again, because you do, and those concepts follow through as you progress through the degree, but you get more focus on one particular topic, which for me is good, because I really struggle to kind of split myself into multiple topics all in one go. And I like the fact that we've got more of a focus. So that's a little bit about pharmacy at Auckland and how the learning goes. When you're in pharmacy in both unis, you also do practical exams called OSCEs, and it's a clinical exam that you do. For pharmacy, it's normally once a semester. So you have 2 12-week, pretty much kind of like 12 to 14-week semesters in each year. And in each semester, you have an OSCE where what you've learned in terms of your practical skills, so less so your drug knowledge, your anatomy knowledge, more how you educate people on medicines, how do you review a prescription that a doctor's written to make sure that it's legal and that it's safe. You get assessed on how well you can do that and how well you know the process. So you'll have like a legal station where you get given a doctor's prescription, like a fake doctor's prescription, and you have to go through it and you go, yep, it's got a date on it. Yep, the doctor's signed it, or it's got a barcode. So you're doing more than just bookwork. There's a lot of practical aspects. And through pharmacy, you also have placements. Because I'm at Auckland, I'm not entirely sure how the placements work at Otago, but at Auckland, once you, in second year, you do like 7 days of placement in semester 2, very low key, very easy, just to kind of introduce you into hospital and community pharmacy environments. And then in year 3 and year 4, you go on 2-week placement blocks. So earlier in the year, I spent 2 weeks in the Hawke's Bay at their hospital, and you're basically doing full-time work, essentially, just learning about what you actually do on the job. So you get to talk to patients and doctors, and you get to sit in ward rounds and walk around with the doctors and nurses, and basically get a full-on view of how the job actually is. And then in community, it's more like what you've probably experienced is like your local unichems, life pharmacy, or your like independent pharmacies where you'd normally collect your medicines. So you do have the option to kind of go to different places, and through both unis, you can do placements across all of New Zealand. So in general, there's a requirement where you have to do one outside of the centre where you're studying. So in Auckland, you have to do at least one placement outside of Auckland. So so I've done one. So I did Hawke's Bay, and then I was a lot more local for the placement I did a few weeks ago. And those placements, they are not paid. So in New Zealand, stuff like clinical placements are not paid. Sometimes the university will offer not like a financial incentive, but they might reimburse you for some of the costs. So there definitely, even though it can seem quite challenging, there definitely is help through the unis to actually get you through those placements. So I wouldn't get too worried too early on about what you would do in that situation, because there is help available. And in terms of entry to the different universities, through Auckland, if you go through the Bachelor of Health Science, you need a rank score of 200. I think I have it written down. A rank score of 250. So for a rank score of 250, and you also need to have 18 credits in an English-based subject. So that can be English, classical studies, geography, history, art history, any of those, social studies. That also counts towards if you're doing like a Tertiary paper, you can use those for English credits too. And you also need 18 credits from science. I highly recommend, if pharmacy is an interest, chemistry and biology. Definitely, they're recurring themes that happen, probably even more so biology than chemistry, comes up quite a lot through the degree. You're going to see it when you get into uni. It's going to be a paper that you have to do. So those are definitely ones that I recommend. And for Bachelor of Science Biomed, if you're doing that pathway, you need a rank score of 280. So it is a little bit higher, and it's a little bit higher because it gives you wider access to some of the clinical programs. So like I said before, if you are going through the biomed pathway, one of your papers will be physics in semester 2, and that means you can do medical imaging, and you can also do optometry because they both use physics. And for that, for biomed, you don't need to worry so much about your English-based papers. Your sciences are really important, and also doing a maths paper. So that's where you need to be focusing on subject-wise. We going all good, Sam? Cool, perfect. Yeah, so that's Auckland. Auckland does also have pathways if you are Māori or Pacifica. They have MAPAS, which is a slightly different program for getting into basically for getting into university and the clinical programs. So it's basically a separate entrance pathway. So if you do like kaupapa Māori, you can go through that pathway, and that also opens opportunities in terms of like further tutoring with students from similar backgrounds. So that's something that's available. So if there's a subject that you're not particularly good at, it's okay. Like I did biomed. I really struggled with physics. I went to some of the, like, you find some of the tutoring sessions, and that's what you do. Like, you're not going to be good at every subject, and that's okay. You have to work to your strengths. So there is MAPAS. There is also a rural students pathway. And I think Auckland also has a students from a refugee background pathway as well. And then for Otago, there's also pathways to help with that. So yeah, if you are Māori or Pacifica, they've got a pathway as well. And yeah, it opens you up to like extra help in terms of tutoring, if that's something that you need, student clubs and things like that. So the unis do try as best as they can to make it equitable and to make sure that everyone has the same opportunities to get into these programs, because we need people from all different backgrounds. It shouldn't just be people from Auckland or, yeah, basically main city centres. It can be people from, yeah, all backgrounds in New Zealand. Yeah. Oh, and the other thing with pharmacy is once you graduate, you think you're done learning. You're not done learning. You graduate pharmacy and you also have to do a 1-year internship or a 40-week internship, which is paid. So don't worry. When you graduate, you do get to call yourself a pharmacist, but you have to be an intern pharmacist for 40 weeks of the year, which is, yeah, you're getting paid. So you find an internship site. They basically, it's just like kind of extra learning just to kind of push you over that line to make sure that you're fully confident in your skills as a pharmacist, just because compared to other programs, you don't get as much time with patients when you're a pharmacy student, because a lot of what we learn is at uni. Like it's one of those degrees where you can't just go to a pharmacy and be learning on the job. Yes, it's important, but you have to know the medicines. You have to know like how to manage multiple medicines. So there is a lot of book work, and that is stressful, and it's a lot of memorization, but I think it's easier than like book work you're not that bothered about, because it all ties together when you do your internship and you get to talk to patients. And yeah, then you get paid to be a full pharmacist. But I think we can have some questions if people have any questions to ask.
Awesome. Thank you so much, Asia. That was a good overview of a day in the life of a pharmacy student and a good background as well. But yes, if anyone does have any questions, feel free to throw them in the chat and I will keep an eye on it. However, I thought we could also start with some of the previously submitted questions, if that's all right. So one of the questions that we do get is, what can a pharmacist do other than work at Unichem or a community pharmacy? Because that's oftentimes where we see them most.
Yeah. So basically, when you go on placement, most of the time you are going to be on placement either in a hospital or you're going to be on placement in a community pharmacy. So yeah, like your Unichems. There is sometimes opportunities to do placements in other places, like government organisations, MedSafe, who are the people who approve medicines for use in New Zealand, Pharmac, who is the government body who decide what medicines get funded. And they're places you can do placements. For internship, you do have to, you're pretty much always going to be in a community or in a hospital. But in terms of what pharmacists can do after that point, you can work in governance. So yeah, pharmacists have a really good knowledge of the law, because a lot of what we learn is based on the law. I mean, giving out prescription medicines, there's a lot of legal stuff to it. So yeah, you can do governance. You can go into drug research, so you can help run clinical trials. That's something that's available. So we do have clinical trials that get run in New Zealand. You can be a clinical trials pharmacist. You can specialize in the hospital. So you can be just a clinical pharmacist, which is just a pharmacist who could be in any of the wards in the hospital, or you could be like one of my lecturers was a transplant pharmacist. So he was in the transplant ward. That was his focus. You can do like you can be in the like dietetic space, so like the nutritional kind of supplements and stuff. Yeah, there's a huge range, and you don't have to do anything that's patient-based if you don't want to. You can also be a pharmacist who is involved in making up stuff like chemotherapy drugs. So in that situation, you're not doing something as patient-based, but it's a lot more, you're in like a sterile environment, and you get to scrub up, and it's like more hands-on, which is really nice. Yeah, so you definitely, while most pharmacists do work in community pharmacies, because it's nice having that 9 to 5 of a community pharmacy, you definitely don't just have to do that. It could be the hospital. You could work in the government. You could work in pharmac, recommending drugs to get approved. There's lots of stuff you can do outside of just handing out pills.
That's really good to know that you can kind of, if you really like a specific area or have a further interest in different other health careers, you can kind of work alongside them.
Yeah.
And for some of those options, would you need to further your career? Like, do you need to do further studies as well to achieve those kind of specialties?
So it really depends on which companies and like which employers you'd be looking at. If you want to be a hospital pharmacist or a clinical pharmacist, you can actually do that straight away through your internship. So that's what you can do, your internship there. And that makes you basically a clinical pharmacist. There are more study options you can do to further that, but it's not compulsory. So a lot of the hospital pharmacists in particular do go on to do more, and that's just to kind of expand their knowledge a little bit more, because sometimes what you're dealing with in hospital is a lot more complex. That's why people are admitted. But you can also do things like be a prescribing pharmacist, where there's actually like 2,000 drugs on a list. You're allowed to prescribe them the same way a doctor would. And if you want to do something like that, you have to do an extra 1.5 years or so worth of study with supervision by a doctor. And then you'll then get a qualification to allow you to prescribe drugs too. So sometimes you do. A lot of the time you don't, and it's more of an experience-based thing. And a lot of the hospitals in New Zealand, if that's what you're going into, like say I went and I did my internship in a hospital, if I expressed an interest in, I don't know, dermatology and the skin, they would just give more opportunities to me in that area. So you can just kind of build your focus that way.
That's cool that they've made it so accessible as well. So if you do have an interest. You did mention studying in New Zealand, and one of the questions that has come up is, can you work in other countries?
So it's a bit of a difficult one with pharmacy, to be honest. You can. So the degree is directly transferable to Australia. So that at the moment, Australia is the only country where you don't really have to jump through any hoops. You can do your internship in Australia as well. It's the same program with a different name. So you can do that. If you want to go anywhere else, you can, and the Auckland and Otago's degrees, the BPharm is recognized as a degree, but you will normally have to jump through extra hoops basically, and go through a period of being supervised, because you don't know, like they're going to have different medicines available. They might have different ways of treating diseases. So, and like there is a bit of a learning curve, because New Zealand might have its own, a lot of the time we work through like I don't know, like pathways, basically. We have a way of treating something and it might be different somewhere else. But a lot of it is also around the law. So a lot of the laws in Australia are quite similar to here, and that makes it easy to transfer. If you want to go somewhere else, you've got a lot more learning to do in terms of that and making sure that your practice is legal and ethical. So it is a bit harder, not impossible, and a lot of pharmacists do go elsewhere, but it is a bit more complex. But as far as I know, they'd closed off transferring the qualification to the UK. So previously, we like pharmacists could go to the UK and it was you'd work directly. You could just go over and do it, same way as Australia. When the UK left the EU, that got stopped. But as far as I know, that at some point will be coming back. So that might be an option in the future too. If people want to go to like the UK, that will probably be available as well. But as far as I know at the moment, it is just Australia.
I guess the healthcare world is also always changing and developing, and it is a 4-year degree, is that
Yeah,
correct?
yeah, four
Yeah,
in
so
total.
who knows what happens in 4 years' time.
Yeah,
So something you did mention in your presentation as well was a pharmacy technician. Could you
yes.
just explain briefly what's the difference between a pharmacist and a pharmacy technician?
Yeah, so in New Zealand we have both. So you'll often see so they both it sometimes gets confusing because they both wear a white coat. But basically a pharmacist is a protected career title. So you can only call yourself a pharmacist if you've gone through a Bachelor of Pharmacy and you've gained that registration status. So a pharmacist has done a Bachelor of Pharmacy, they've done that 4-year degree, or maybe, I don't know, in another country possibly. And that means that you're the person managing the pharmacy. You are the one overseeing all of the dispensing in the dispensary if it's in a community pharmacy. So once you've finished your internship, that means that you you can work alone, basically, that you don't need supervision. What you do doesn't need to get checked off. So you've got all of the skills to be able to see a prescription, hand out the medicine, and sign it off and go, yeah, this is for you. It's all safe. I've checked it. That's fine. A pharmacy technician is someone who has done like basically a 1-year technician course, and that can be online or in person in some parts of the country. And you can dispense medicines, but you can't dispense them without the supervision of a registered pharmacist. So a technician will take the medicines off the shelf, label them, put them through the system, but before they go out to the patient, they have to get checked by the pharmacist. So there's the technicians are more kind of there to take a lot of the weight in terms of the dispensing medicines off of pharmacists, because where pharmacist skills are really important is actually that drug checking process, the safety, the legality, those clinical checks that really utilize what we learn at university. So yeah, it just brings in the more time you've spent at university, basically.
So a pharmacist would actually kind of have to be quite a good leadership role as well. Oftentimes you'll
Yeah.
have people working under you as well. So does that
Yes.
mean a pharmacist, if they wanted to, they could make their own pharmacy, or if they're in their own kind of
Yeah.
community as well?
Yeah. So in New Zealand, pharmacies have to be owned by a pharmacist. So you have to be a pharmacist to be able to own and operate one. And that's because you're basically you've got that qualification that says you know how it works. You're going to run it properly, you're going to run it safely, and you're responsible for the medicines you're handing out and the patients that you're handing them out to. So that's really important. And being a pharmacist, yeah, it is a leadership role. So you can own a pharmacy if you want to, but you also might be the only one working in the dispensary. And that's something that only a pharmacist can do. A pharmacy technician wouldn't be able to do that. Yeah, so it's a more of an independent role, I would say. You can definitely progress up in terms of leadership. So yeah, you can run a team, you can own a pharmacy. Yeah, that's really good leadership role.
That's really cool to hear, and it might relate to some people as well who may not have thought about these different aspects and who you actually interact with.
Yeah.
So obviously kind of these webinars are mainly focused for our high school students who are wanting to go to university. And a lot of the big fears that they may have around going towards university is that kind of transition process. So how can you prepare for that kind of first year health sci? And is there any interviews or any tests that you have to do to go towards it?
So yeah, prep is scary. Leaving sometimes year 12, normally year 13. It's a stressful time, it's really daunting, and you don't know what to expect. Um, there is an interview. I'm pretty sure it's the same for Otago and at Auckland. You do have to do an interview, which is stations. So they look at what your grades have been for the year. For Auckland, in general, if you've got kind of a 70% average across the year, you're going to get offered an interview. And that interview, it's not like a job interview. It's more they're looking at your knowledge of cultural issues, like what's going on in the world of like LGBTQ spaces, like what they're looking at, what ethical you can be in terms of like treating patients and stuff, if that makes sense. So they're looking at like your wider knowledge. What's your motivation for going into this career? Is it the right thing for you, and why do you want it? Because it's really important. We don't want people working in the careers if they're not invested. So that's more what they're kind of interviewing for. And it's just kind of short, I think it's like 8-minute stations is how they run it. In terms of the tests, you do have to pass everything. So it is a stressful time going into that first year. Scene, because you're doing it with a lot of people, especially from a rural background. Like, you go to these unis, there is so many people, and there's so much going on, but you do have to pass everything. In general, if it's for pharmacy, about a 70% is going to get you a good chance of getting that interview. And then that interview is more kind of, it's not so much about what you've learned at uni, and it's more about who you are as a person. Yeah.
And as you're mentioning with pharmacy study and how it's kind of different modules each time, did you have any good studying tips or ways to help with that different type of learning style?
Yeah, definitely. So it's definitely it's quite a jarring change from going to, doing 6 weeks of something, sitting a mid-semester test, doing 6 weeks, and then having a final exam, which is how most of those first year papers run. When I moved into it, it was a bit just like, whoa, okay, we're doing everything and it's all linked, but in 4 weeks' time, we're getting tested on it. So it's quick turnaround. For me, I found everyone always says it, and I know people cringe every time, go to the lectures. The science shows that people that go to the lectures always do better. Go to the lectures. Don't watch the recordings as your main form of study. Go to the lectures. You just absorb more. I don't know what it is. You just do. And I speak from experience. It is true. But I also find I take a look at the slides before I go to the lecture, so I've got a general overview of what they're going to be talking about. And then when I get into a lecture, I only annotate stuff that's not already on the slides. Rewriting notes is something that everyone does when they first go to university. You think that's the way to go. I'll just rewrite the notes. It just takes so long. You're doing stuff at a higher level than you were at high school, and there's so much to know in such a little time. Don't rewrite the slides. It's best to think about linking concepts. So I might go like, I don't know, what have we, I don't know, thinking about what we've learned, like say, I don't know, a cold, like you've got a cold, and I'll think about it and go, okay, this person's got like a bacterial infection, like throat infection, and think, okay, how has that happened? What can we use to treat it? What's going to be the best way for this patient? So it's linking everything together instead of going, here's 40 drugs, let me learn all the 40 drugs. Here's 6 different diseases, let me learn all the diseases. Think about it more wider. So I use a lot of mind maps, a lot of annotating. Yeah, if you can draw stuff, so much more helpful than just like typing things out. Typing notes is fine, but it's making sure that you're doing it concisely. You're not rote learning everything off lectures. And if you have access to past questions, use them, because that's your core knowledge. Yeah.
I guess everyone will also kind of try different studying techniques. And if you're more of a visual learner, or if you find flashcards and doing short tests
Yes.
might help you, but definitely try it out, especially in that first year as well. Even if you're doing year 13's exams coming up, try different ones, see what works for you, and
Yeah, and
hopefully
study
you'll.
with friends. Study with friends. Like if you've got friends that are in the same class or the same paper, sit down in a quiet space and go, right, here's a question. How are we going to attack it? How are we going to answer it? And then that way you're getting everyone's strengths and everyone's knowledge come together. And you might find that it's making more sense in your head when someone else explains it. And that's a lot of people don't really do that. And then you might sit in a room and have a chat and go, oh, actually, that makes more sense now that someone else has talked to me about it. And that was something that I found so helpful coming into pharmacy, is saying like, hey guys, I've booked one of the study rooms. Let's sit and just quick fire through the content. Makes a world of difference.
And speaking of friends as well, do you know of any clubs or groups that would be good, especially for pharmacy students or at Auckland University, as you're currently there, that should get involved with?
Yeah, definitely. So I'm involved in 2 this year. So I'm part of Students of Rural Health. Yeah, which very important. Rural health, definitely a lack of pharmacists in that space at the moment, guys. So rural pharmacists, we need them. Please get involved, especially through SOHA. And then I'm also involved in the Women in Health Network. So obviously Students of Rural Health, if you've got, and there's also a grassroots club. So if you're interested in rural, those are definitely the places to go. There's a lot of opportunities, school visits, events, just getting to know other people who are interested in rural health, conferences. If you like, for women and minority groups, like gender diverse people, Women in Health is really good. I love the fact that that's all about making connections with other health professionals who are studying too. And then at both unis, there is a pharmacy students association. So, and what's cool is we do actually talk to each other. So the people in Auckland Pharmacy Student Association do communicate with the people in Otago. So sometimes there is cool like little online events where we all get to know each other, because we'll be like, yeah, we're going to be working together eventually. And there's also sports and things like that, which is like, if you're a sporty person, there's honestly, I think there's a club for every sport, but the Pharmacy Student Association is there and it's available to all pharmacy students. And there's so many cool events. You get to meet so many cool people, professionals. Yeah, they run so much stuff, like either academic or just social. Yeah.
And how do you find that balance between study and also kind of social or friend groups? Is it quite important, or is it quite a lot of study work? Yeah, how do you find it?
So study's important, right? Like it's, you need to pass the papers and you need to get through the degree, so you definitely can't slack. But I think people actually end up doing better if they find a balance. If you wear yourself down studying constantly, that burnout hits you quite quickly, and not having that kind of safety net of friends, colleagues, other people that you're studying with, that can really make things even harder. So I think it is difficult when you first start trying to find that balance. But in uni, you generally always kind of get told for each paper, so say you're doing 4 papers in first year, each paper you should be setting aside 10 hours a week for that paper. So that includes in-person time. So that includes your lectures. So you have to treat it like a full-time job. And it makes sense, right? it's a lot to do. So the way I try to do it, and it doesn't always work because life gets in the way, is try to treat it like a full-time job. So if my first class isn't until 10, then I might still try to get into uni for 9. And those gaps between classes, I'm putting towards my study. And then as soon as that's done, I can go home, play video games, go out with my friends. It's important to not overwork yourself. Finding the balance is difficult, but especially when you're in these clinical degrees, and I found it pharmacy in particular, you're all in the same boat. Like you're all going to graduate together. You all know each other. You're all under the same stress. So if someone says, "Hey, let's go and get lunch together," go for it because you're in the same boat anyway. And you might end up talking about study anyway, so you may even learn something, but you have to give yourself time. Like if you go to the gym, make sure you keep up with those habits and those things you enjoy, because it's going to make it easier for you to study as well, because you've got those stress outlets.
And so you did talk about that kind of work-life balance, and obviously for a lot of our rural students as well who may be having to travel to Auckland or Otago, it might be quite a distance. There might be some financial barriers. In your degree, is there opportunities to work or time to work, or is there any scholarships as well to help with those finances?
So there definitely is time to work. Most, if not all, of the students in my cohort, or probably in the pharmacy program at Auckland at the moment, work at a community pharmacy 1 day a week. Because what's nice about it is you're actually applying what you're learning on the job. And I found that if I go to work on a Sunday and I'm going, oh yeah, I know what that medicine does, and oh yeah, this patient is on these medicines, so they maybe have this condition. So I would actually say 1 day a week, it can actually be quite beneficial in pharmacy to work that, especially at a pharmacy, just because, yeah, you're kind of getting that real life experience and you're getting paid for it, which is helpful. In terms of scholarships and stuff, Auckland, so as far as I know, there's no scholarships particularly for pharmacy, but moving into Auckland or Otago, there's scholarships available that are quite high amounts for students in lower decile who have gone to like lower decile schools. That's something that's available. They can go quite high in terms of the amount of money, like tens of thousands of dollars sometimes. But you have to apply for them. They won't just give them to you. You've got to apply. You've got to be onto it. There's top achiever scholarships, and sometimes they also fund accommodation. So they might fund your stay in one of the halls, either in Otago or Auckland. So if accommodation is going to be an issue, that's something to look into as well. Those big scholarships do sometimes offer that. So Hauora Taiwhenua have also got a scholarship open at the moment for student leavers. That's something that people can apply for. And yeah, I think they're the main ones. They're the big ones that the uni runs. And then also, yeah, kind of outside organizations do sometimes have them as well. And yeah, there is also time to work. And sometimes the uni will give you like reimbursement and stuff for things like placement. So I think I got back like $600 for being in Hawke's Bay. So that did definitely offset the cost of placement a bit. So yeah, there is financial support available.
Love it. It's good to know that there are those supports available, and yeah, there is so many scholarships available even through Te Whatu Ora as well. They often have quite a few ones. Unfortunately, we have reached our 45-minute time slot, so unfortunately we'll have to end it here. However, if anyone does have any more questions that they would like to ask Asia, feel free to send them to Hauora Taiwhenua and we can pass them on and hopefully she'll be able to answer them for you. Otherwise, this webinar is being recorded, so it will be posted on our website and YouTube channel as well. So if you need to look back at any other information, you're more than welcome to utilize it as a resource as well. But otherwise, a big thank you, Asia, for your spending this evening with us and answering a little bit about pharmacy. We hope that you guys find this useful, and hopefully Asia might see you guys very shortly at hopefully Auckland or Otago, maybe, who knows.
Who knows? I'll be around.
Brilliant. Well, thank you all so much for joining us, and we hope you have a good evening. Ka kite.
See you all.